Welcome to our medical assistant practice test. This test consists of 100 questions designed to help you prepare for your medical assistant certification exam. Each question includes an explanation of the correct answer, so you can understand the reasoning behind it. Whether you're just starting out in your medical assistant career or you're looking to refresh your knowledge, this practice test is a great way to get a feel for the types of questions you can expect on the actual exam. Let's get started. 1. The following symbol, asterisk. A, is used in the ICD-10 book to designate additional diagnoses. B, is found in the CPT book to designate revised guidelines for code use. C, designates variable pre- and postoperative services. D, none of the above. Correct answer, C, designates variable pre- and postoperative services. Symbols used in the CPT coding manual are used to add additional information to procedural codes. The asterisk is used to note that services used with a particular code vary between pre- and postoperative services. 2. The modifier that notes bilateral procedure is A. 26, B. 50, C. 53, D. 24. Correct answer, B. 50. Modifiers are used with CPT codes to add additional information to a procedural code. A common modifier is -50, which denotes that a procedure that was performed was done on both right and left sides, or bilaterally. 3. In the CPT manual, codes in the range of 99,201 to 99,600 are A. Surgical codes. B. Evaluation and management codes. C. Radiology codes. D. All of the above. Correct answer, B. Evaluation and management codes. E and M codes are CPT codes that are used when a patient is being evaluated and treated. These codes are assigned based on the type of appointment that is done. For example, a patient who is new to the practice would receive an E and M code that designates a new office visit that allows time for a thorough history and examination. 4. When coding using HCPCS, a code that is accompanied by a diamond symbol would indicate. Special instructions are provided that describe how this code should be used to be included for reimbursement. B. This code is not covered or valid with Medicare. C. There is the potential for this code not to be covered by the insurance carrier. D. The code is new. Correct answer, B. This code is not covered or valid with Medicare. Codes that are accompanied by a diamond symbol indicate that the code is not recognized by Medicare and will not be reimbursed. 5. Bank statements. A. Show the current balance for that particular statement period. B. Typically sent to the practice on a monthly basis. C. Must be reconciled when received by the office. D. All of the above. Correct answer, D. All of the above. Bank statements are used to help balance the books. Books are balanced on a monthly basis when the statements are mailed from the bank. 6. A patient sends a check to pay for her last office visit. That check bounces at the bank. Which of the following is the most likely scenario when dealing with this situation? A. The patient will be charged an NSF fee by the office. B. The patient will receive a letter from the bank stating that the account with the doctor's office is closed. C. The bank will honor the check and transfer funds to the office account. D. The patient will receive a notice from the bank stating that cash will be required for all future transactions with the office. Correct answer, the patient will be charged an NSF fee by the office. NSF fees are fees assessed by the office for non-sufficient funds. Banks will typically charge a company a fee if checks bounce. These fees are passed to the writer of the bad check in the form of NSF fees. 7. When writing a check, the amount of the check. A. Is written in both numeric and word form. B. In most cases should exactly match the amount needed for the services rendered. C. Should have the cents written as #/100 where hashtag is the total cents needed. D. All of the above. Correct answer, D. All of the above. The intended amount of a check is written both in numeric and alpha form. Any odd cents that are needed are written numerically as #/100, where the hashtag is the amount of the odd cents needed. Both the numeric and alpha numbers must match in order for the check to be valid. 8. Assets are: A. Securities. B. Machinery. C. Merchandise. D. All of the above. Correct answer, D. All of the above. Assets are any piece of equipment or fund of value that adds worth to the company. 9. Which of the following will increase the owner's equity? A. Drawing. B. Revenue. C. Expenses. D. None of the above. Correct answer, B. Revenue. Equity is one's worth. Revenue is money coming into the organization and will add value. 10. The best way to handle petty cash. A. Is to assign one person to handle it. B. Is to keep it locked in the back office until needed. C. Is to replenish the supply only when it is completely depleted. D. None of the above. Correct answer, A. Is to assign one person to handle it. Petty cash is cash that is used in the office for odds and ends. Having only one person assigned to the petty cash drawer will help to avoid issues with missing money. 11. A patient is on the telephone stating that her son has just been stung by a bee. Which of the following recommendations is used when dealing with this emergency? A. Ask the mother if her son is known to be allergic to bees. B. Ask the mother to tell her son to remain calm and still to help slow the spread of venom. C. Tell the mother to remove the stinger by scraping at the stinger rather than trying to pull it out. D. All of the above are true. Correct answer, D. All of the above are true. Honeybees are known to leave stingers in a patient's body when it has stung. To safely remove the stinger, have the patient scrape at the stinger to avoid unnecessarily adding more venom to the patient's body. Patients should remain calm and still. Patients who are known to have an allergy to bee venom should be treated immediately with an EPI pen or taken to the nearest ER. 12. Which of the following symptoms can occur with a heart attack? A. Cyanosis. B. Syncope. C. Ashen skin. D. All of the above. Correct answer, D. All of the above. The signs and symptoms of a heart attack can vary from patient to patient. The most commonly reported symptoms are fatigue and anxiety, along with chest, arm, or jaw pain. Cyanosis and syncope can also be observed, along with pallor. 13. The most dangerous time of the day for sunburn is: A. Between 10 a.m. and 2 p.m. B. The early morning hours. C. Between 2 p.m. and 4 p.m. D. As long as sunscreen is applied once before going into the sun, there is no danger. Correct answer: between 10 a.m. and 2 p.m. The sun has the highest potential for causing burns between the hours of 10 a.m. and 2 p.m. Sunscreen, while recommended, does not protect users for the entire day and should be reapplied every couple hours throughout the day. 14. The acronym FAST is used to help responders remember the steps to recognizing which of the following conditions: A. Onset of labor in a pregnant woman. B. Stroke. C. Heart attack. D. Migraine. Correct answer, B. Stroke. The acronym FAST stands for Face, Arms, Sentence, and Time. Patients that are having a stroke will show asymmetry of the face, will not be able to hold his arms at the same level out to the sides, will not be able to repeat a sentence, and need to get to the emergency room without wasting time. 15. The rule of nines is used to: A. Determine the amount of the body's surface that has been burned. B. Assess the level of oxygen saturation in a body that has been burned. C. Determine the level of tissue damage that has occurred in a burn. D. None of the above. Correct answer: determine the amount of the body's surface that has been burned. The rule of nines is used to assess the amount of body surface that has been burned. Most body areas are divided based on 9%, with the exception of the genitalia, which is only 1%. 16. First aid for frostbite includes running cold water over the affected area. Warm or hot water will shock the area and cause more tissue damage. B. Run warm water over the area to rewarm the affected area. C. Run hot water over the area to warm the area as quickly as possible. D. Cover the area with a blanket, using a heating pad if the blanket isn't warm enough. Correct answer: B. Run warm water over the area to rewarm the affected area. Frostbite is dangerous because it can take away a patient's ability to accurately assess the temperature of water that is used to treat it. This could result in potential burns, making the frostbite even more dangerous. Warm water should be used to warm the area. Medical assistance is necessary if the tissue appears to be necrotic. 17. A patient is having a grand mal seizure. Which of the following would be appropriate when performing first aid? A. Place a tongue depressor in the patient's mouth so he does not swallow his tongue. B. Restrain the patient in the event his thrashing movements cause him to harm himself. C. Move the patient to an open area where he will be less likely to harm himself while convulsing. D. Shake the patient until he becomes responsive. Correct answer: C. Move the patient to an open area where he will be less likely to harm himself while convulsing. Patients having seizures may or may not convulse and have thrashing movements. Those that are convulsing and thrashing should be moved to an open area where they can remain safe until the seizure subsides. Never place anything into a patient's mouth. Swallowing the tongue is anatomically impossible. 18. Chord cough sounds are: A. Sounds noted during diastole. B. The result of the vibration of blood against artery walls while blood pressure readings are being taken. C. Are only noted by skilled cardiologists. D. Distinct sounds which are classified into 6 phases. Correct answer: B. The result of the vibration of blood against artery walls while blood pressure readings are being taken. Chord cough sounds are sounds generated when the blood starts to flow in an artery that has been temporarily collapsed during a blood pressure reading. There are 5 phases to the chord cough sounds, and many different healthcare providers are trained to assess these phases. 19. Which of the following is an anthropomorphic measurement? A. Blood pressure. B. Temperature. C. Pulse rate. D. Weight. Correct answer: D. Weight. Anthropomorphic measurements are measurements of body size, weight, and proportion. 20. The procedure for taking a pulse rate on an infant differs from an adult. How? A. Pulse rates are not taken on infants. B. The apical pulse method is used on infants. C. Pulse rates on infants are taken with a sphygmomanometer. D. Pulse rates on infants are taken apically in the third intercostal space. Correct answer: B. The apical pulse method is used on infants. The apical pulse method is used in infants by placing a stethoscope in the 5th intercostal space, mid-clavicular line, and counting the beats for a full minute. This method can also be used on adults if the radial pulse method is difficult to perform. 21. The patient position that is most useful for proctologic exams is the A. Trendelenburg. B. Semi-Fowlers. C. Full Fowlers. D. Jackknife. Correct answer: D. Jackknife. The jackknife position is used on a specially designed table which allows the patient to lay face down, but keeps the buttocks elevated. 22. A physician may assess turgor when A. Iron deficiency is suspected. B. Heart and lung issues are suspected. C. Dehydration is suspected. D. None of the above. Correct answer: C. Dehydration is suspected. Skin turgor is assessed when dehydration is expected. The skin is slightly pinched and the amount of time that the skin takes to reassume the normal position is related to a patient's level of hydration. The longer the skin stays folded in the pinched position, the better the chance the patient is dehydrated. 23. In the chain of infection, the susceptible host. A. Is one that has been effectively immunized against the infectious agent. B. Is not capable of supporting the growth of an infectious agent. C. Can reduce the chances of being infected by living a healthy lifestyle and using proper hand washing techniques. D. Will not benefit from practicing aseptic techniques. Correct answer: C. Can reduce the chances of being infected by living a healthy lifestyle and using proper hand washing techniques. A susceptible host is one that is capable of being infected with an infectious organism and supporting that organism's growth. Hand washing and aseptic techniques can help to reduce the spread of infectious agents. Being immunized against an infectious agent greatly reduces the risk of contracting an infectious agent and succumbing to that agent's disease. 24. The proper personal protective equipment necessary for collecting a sputum specimen would include. Choose the best answer. A. Gloves and face mask. B. Level 3 bio-containment uniforms. C. Eye protection and shoe covers. D. Splash shield and face mask. Correct answer: gloves and face mask. Sputum samples could contain potential airborne droplets that may spread disease. Using a face mask and gloves will prevent the spread of infectious agents by protecting the respiratory tract, and gloves will prevent the spread of contaminants by the hands. 25. Surgical asepsis is being performed when A. Wiping down exam tables with bleach. B. Sterilizing instruments. C. Changing table paper. D. Wearing gloves when performing injections. Correct answer: B. Sterilizing instruments. Surgical asepsis is the process of preventing pathogens from entering a patient's body. This is done by using sterilization procedures. 26. The most effective step of hand washing is A. Using friction to remove potential pathogens. B. Using hospital-grade soap. C. Moisturizing the hands after washing to prevent cracking. D. Washing hands for at least 15 seconds. Correct answer: using friction to remove potential pathogens. While all of the answers are part of an effective hand washing procedure, the use of friction when washing is the most effective method of removing debris and potential pathogens from the hands. 27. When performing an EKG, the patient starts to laugh out of feelings of anxiety. What would you expect the EKG to show? Choose the best answer. A. Increased pulse rate, normal EKG. B. Decreased pulse rate, abnormal EKG. C. Tachycardia, poor EKG graph. D. Bradycardia, poor EKG graph. Correct answer: C. Tachycardia, poor EKG graph. Patients who are unable to lie still on the exam table while having an EKG will have poor readouts on the EKG. Electrical signals given off by large moving muscles will inhibit the collection of data from the chest leads. Patients who are very anxious will usually display a rapid heartbeat. 28. When printing out an EKG, a medical assistant notices that the QRS complexes are extremely small. What should be the next step? A. Alert the physician immediately, as this is a sign of impending cardiac arrest. B. Check to see that all leads are attached and rerun the EKG. C. Increase the sensitivity control to 20 mm deflection. D. Decrease the run speed to 50. Correct answer: C. Increase the sensitivity control to 20 mm deflection. Increasing the sensitivity control to 20 mm will double the sensitivity, which will allow for better observation of the small QRS complexes. 29. Each small square on the EKG paper is A. 4 seconds long and 5 mm tall. B. 2 seconds long and 5 mm tall. C. 4 seconds long and 20 mm tall. D. 4 seconds long and 1 mm tall. Correct answer, D. 4 seconds long and 1 mm tall. Each small square of the EKG paper represents 0.04 seconds long and 1 mm tall. One large square will be 5 small squares long and 5 small squares tall, equating to 0.2 seconds long and 5 mm tall, 0.5 mV. 30. Malpractice that has been ruled because of a physician's failure to act is a form of A. Misfeasance. B. Malfeasance. C. Infeasance. D. Nonfeasance. Correct answer, D. Nonfeasance. Nonfeasance is defined as failure to act. When a physician fails to act and it's ruled malpractice, this is categorized as nonfeasance. Misfeasance is performing a procedure incorrectly, and malfeasance is performing the wrong procedure. 31. A medical assistant volunteers her time at a local charity run checking blood pressures. She A. is covered under the Good Samaritan law because she is volunteering her time. B. is not covered under the Good Samaritan law because she is performing the duties of a medical assistant. C. is covered under the Good Samaritan law because she is performing the duties of a medical assistant. D. possibly may be covered depending on how many blood pressures she takes. Correct answer, B. is not covered under the Good Samaritan law because she is performing the duties of a medical assistant. The Good Samaritan law protects healthcare workers who respond and provide medical care outside of the work environment. However, volunteer activities where professionals are voluntarily performing skills that they would use in the workplace are not covered under this law. 32. Torts are A. Civil wrongs subject to a lawsuit. B. Acts of criminal law. C. Not legally enforceable in free clinic settings. D. Punishable by imprisonment in a federal penitentiary. Correct answer, civil wrongs subject to a lawsuit. Torts are acts of wrongdoing. They fall under civil law. 33. Who of the following wrote a medical code of ethics? A. Hammurabi. B. Thomas Percival. C. Hippocrates. D. All of the above. Correct answer, D. All of the above. All of these philosophers wrote some form of medical ethics code. Hammurabi wrote the first code in 2500 BC. Hippocrates is famed for, do no harm. Thomas Percival was a physician with an interest in sociological medicine and wrote a code of medical ethics in 1803. 34. An example of slander is A. A medical assistant falsely criticizing another medical assistant's skills. B. A medical assistant restraining a patient against her will. C. A medical assistant writing defamatory statements about a doctor on her Facebook wall. D. A medical assistant calling a coder's supervisor to report a billing error. Correct answer, A. A medical assistant falsely criticizing another medical assistant's skills. Slander is spoken words that could negatively impact the reputation of another individual. Written words that have the same implication are known as libel. 35. A patient pulls up her sleeve in preparation for an injection. This is an example of A. Informed consent. B. Implied consent. C. Unwritten contractual consent. D. Expressed consent. Correct answer, B. Implied consent. Even though the patient hasn't given verbal permission to have a procedure done, her unspoken body language has implied this message. 36. Which of the following agency sets the standards for employees' safety in the medical office? A. AMA. B. MA. C. CDC. D. OSHA. Correct answer, D. OSHA. The Occupational Safety and Health Administration oversees safety in the workplace and is federally mandated. 37. In order to address ethical issues. A. Professional organizations establish codes and creeds. B. Employers force employees to sign moral standards requirements upon beginning employment. C. Employers encourage employees to attend religious service. D. Potential candidates for a position in healthcare will be screened for moral and ethical shortcomings. Correct answer, professional organizations establish codes and creeds. Ethical issues can be difficult to address as many employees have different personal morals. In order to standardize these codes, professional organizations develop ethical codes that are agreed upon by the members belonging to the organization. The AMA has established its own code of ethics for medical assistants belonging to it. 38. A medical assistant witnesses a coworker forging a signature on a patient's chart. Which of the following is most true? A. The forgery is not a criminal act, but a civil violation. B. The medical assistant who witnessed the forgery is completely innocent of any act. C. The medical assistant that witnessed the forgery is liable for wrongdoing if she does not report the incident. D. The forgery of the document is nonfeasance. Correct answer, C. The medical assistant that witnessed the forgery is liable for wrongdoing if she does not report the incident. If a medical assistant witnesses unethical behavior, she should report it to her supervisor immediately. Failure to report this type of activity could negatively impact her future in her place of business and her career. 39. A medical assistant who fails to act in a manner that is considered reasonable for someone working in that job capacity is considered to be A. Fraudulent. B. Abusive. C. Acting outside of her scope of practice. D. Negligent. Correct answer, D. Negligent. The definition of negligence is failure to act in a manner that a prudent and reasonable person would under similar circumstances. 40. Which of the following is not a section of the PILMAR? A. Database. B. Problem list. C. Treatment plan. D. Patient appointment schedule and payment plan. Correct answer, D. Patient appointment schedule and payment plan. The problem-oriented medical record is set up in sections which will include the database, problem list, and treatment plan. Patient scheduling systems are kept separate from the PILMAR. 41. A medical assistant realizes after a patient has left the office that she forgot to put the patient's complaint of a sore throat. Which of the following choices would best correct her error? A. Pull out that page of the chart and rewrite it with the correct information. B. Put one line through the original chief complaint, write, error, your initials and today's date. Make the correction by rewriting the CC with the correct information. C. Go to the next available line of the SOAP notes. Write the current date, then, late entry. Place the date and time when the patient stated she had a sore throat. Sign and date the entry. D. All of the above are incorrect. Correct answer, C. Go to the next available line of the SOAP notes. Write the current date, then, late entry. Place the date and time when the patient stated she had a sore throat. Sign and date the entry. When placing additional information into a patient's chart, using the phrase, late entry, will alert the reader that the information was added after the fact and will reduce discrepancies that may result from confusion. 42. When filing using the terminal digits method, which would be true? A. The filing is done using the last one or two digits of the patient's medical record number. B. It is the simplest way to file. C. The patient will acquire multiple charts. D. All of the above are false. Correct answer, The filing is done using the last 1 or 2 digits of the patient's medical record number. Terminal digit filing is a filing method that uses the patient's medical record number to dictate where the file is stored. Using the last 1 or 2 numbers of the medical record number helps to keep charts filed in an easy-to-retrieve manner. 43. Out guides are used when charts need to be labeled appropriately for ease of retrieval. B. Charts have been removed from their filing location. C. 2 patients have the same name and their charts must have distinguishing marks. D. None of the above. Correct answer: B. Charts have been removed from their filing location. An out guide is a marker that is put in place of a chart that is pulled from a filing cabinet. The out guide notifies office employees that a chart is missing and aids employees in refiling the chart. 44. A patient presents with vesicles covering the upper torso. Which of the following situations could cause this condition? A. Knife fight. B. Auto accident. C. Sunburn. D. Fungal infection. Correct answer: C. Sunburn. Vesicles is the medical term for blisters. A second-degree sunburn could blister, forming vesicles over the affected area. 45. A child is diagnosed with a green stick fracture. Which of the following most accurately describes the broken bone? A. Compound fracture of the fibula. B. A partial break in a long bone. C. Fracture of the growth plate of the ulna near the wrist. D. Cole's fracture of the tibia. Correct answer: B. A partial break in a long bone. Green stick fractures are commonly found in children. Sudden impact of a bone could lead to the bone bending and partially breaking, such as what is seen when a green stick from a tree is bent in half. 46. When reading a lab report, you notice that a patient's sample is described as having anisocitosis. Which of the following most accurately describes the patient's condition? A. The patient has an abnormal condition of skin cells. B. The patient's red blood cells vary in size. C. The patient has a high level of fat cells and is obese. D. The patient's cells are indicative of necrosis. Correct answer: B. The patient's red blood cells vary in size. Anisocitosis is a term meaning variation in size. Patients with anisocitosis will have red blood cells that vary in size. Poikilocytosis is a term meaning variation in shape of the red blood cells. Both are commonly found in blood diseases. 47. One of the 3 smallest bones in the body is the A. Vomer. B. Distal phalange of the small toe. C. Stapes. D. Coccyx. Correct answer: C. Stapes. The 3 smallest bones in the body are located in the inner ear and include the malleus, incus, and stapes. 48. A patient is having a colposcopy procedure performed. How should the patient be instructed to prepare for the procedure? A. NPO for 8 to 12 hours before the procedure. B. D/C all HTNRX for 2 days prior to the procedure. C. Take 3 Dulcolax tablets and 2 containers of Miralax the day before to clear out the lower GI system. D. None of the above prep is necessary for this type of procedure. Correct answer: D. None of the above prep is necessary for this type of procedure. A colposcopy procedure is done to view the vagina and cervix. The only preparation that is necessary is to wash the external genitals with soap and water the morning before the procedure. 49. Which of the following organs would be described as being located retroperitoneally? A. Kidneys. B. Thymus. C. Small intestines. D. Spleen. Correct answer: A. Kidneys. The term retroperitoneal means to be placed behind the peritoneum. The kidneys are located in this area. 50. The heat-regulating center of the brain is the A. Hypothalamus. B. Pituitary gland. C. Pons. D. Medulla oblongata. Correct answer, A. Hypothalamus. The hypothalamus is the heat-regulating center of the brain. It also has control over the pituitary glands, which is the master endocrine gland. 51. A patient with Bell's palsy would have which of the following complaints? A. Paralysis of the right or left arm. B. Malfunction of a certain cranial nerve. C. A subcondition of cerebral palsy. D. A side effect of a stroke. Correct answer, B. Malfunction of a certain cranial nerve. Bell's palsy has symptoms similar to stroke, but is caused by a malfunction of the facial nerve, which is cranial nerve 7. 52. A pathologic condition described as increased intraocular pressure of the eye is A. Detached retina. B. Fovea centralis. C. Presbyopia. D. Glaucoma. Correct answer, D. Glaucoma. Glaucoma is a condition that is caused by increased intraocular pressure in the eye. If not treated, glaucoma can lead to blindness. 53. The anatomic structure located in the middle of the heart which separates the right and left ventricles is the A. Septum. B. Sputum. C. Separator. D. None of the above. Correct answer, septum. The septum is located in the middle of the heart and separates the right and left sides. Cells of the cardiac conduction system can also be found in this structure. 54. Which of the following bony landmarks is described by large, blunt, irregularly shaped process, such as that found on the lateral aspect of the proximal femur? A. Tubercle. B. Tuberosity. C. Condyle. D. Trochanter. Correct answer, D. Trochanter. The greater trochanter is found on the lateral aspect of the proximal femur and is a bony process that is large. This process forms the attachment site for many muscle of the legs. 55. MSDS sheets. A. Contain the ordering information for each piece of equipment in the office. B. Are required by OSHA to be accessible to all employees of the office. C. Can be used to treat patients who have been injured in equipment accidents. D. None of the above. Correct answer, B. Are required by OSHA to be accessible to all employees of the office. Materials safety data sheets are used to provide employees information on all chemicals that are used in their place of work. Health information is readily accessible and can be used to help employees who have been injured by the use of these chemicals. 56. The most virulent blood-borne pathogen is, choose the best answer. A. HCV. B. HPV. C. HAV. D. HBV. Correct answer, A. HCV. Hepatitis C is 100 times more virulent than hepatitis B. 57. The NFPA diamond has 4 colors. The blue diamond. A. Indicates hazards to health. B. Designates that it is safe to use water to put out this type of fire. C. Indicates that ice is necessary to treat an injury with this type of chemical. D. Indicates that the chemical may be incinerated upon disposal. Correct answer, A. Indicates hazards to health. The National Fire Protection Agency has designated a safety diamond to be used to indicate the threat level of a particular chemical. The blue diamond indicates potential hazards to a user's health when the particular chemical is used. 58. A patient has been told to monitor her LH levels. Which of the following potential conditions might the patient be suffering from? A. Menorrhagia. B. Graves' disease. C. Menopause. D. Infertility. Correct answer, D. Infertility. Luteinizing hormone is released by the pituitary gland to stimulate ovulation. Women with infertility monitor LH levels to time intercourse to achieve conception. 59. Manual hematocrits are done. A. To monitor anemia. B. By using a microcrit tube. C. To measure the percentage of plasma to cells. D. All of the above. Correct answer, D. All of the above. Manual hematocrits are a CLIA waived method for monitoring anemia. Blood is collected in a microcrit tube, centrifuged, and the percentage of plasma to cells is measured. 60. The best blood collection location for a newborn is A. The AC. B. The veins of the forehead. C. The heel. D. The fingertips. Correct answer, C. The heel. Collecting blood specimens from newborns is most safely done by collecting blood from the lateral or medial aspect of the baby's heel. 61. A patient has come to the office for a blood draw. The patient starts to sweat and is very anxious. Which of the following would be the best way to proceed? A. Do not perform the procedure. Notify the physician of the reason why. B. Perform the procedure but pay close attention for signs of potential syncope. C. Allow the patient to reschedule for a time where he isn't as anxious. D. Have the physician draw the blood. Correct answer, B. Perform the procedure but pay close attention for signs of potential syncope. Sweating is a common occurrence with anxiety. Provided the patient is not showing signs of fainting, the phlebotomy procedure can be performed. Notify the physician if the patient does faint. 62. Which of the following tests would most likely be performed on a patient that is being monitored for coagulation therapy? A. Point/INR. B. CBC. C. HCT. D. WBC. Correct answer, PT/INR. Prothrombin times, PT/INR, are frequently used to monitor Coumadin, warfarin, therapy. This medication is an anticoagulant which slows the blood's ability to clot. 63. Interoffice memos. A. Are more informal than a standard letter. B. Contain a complimentary close. C. Contain a salutation. D. None of the above. Correct answer, are more informal than a standard letter. Interoffice memos are used to send quick notes to staff in an informal form. 64. When writing a letter in full block style, the complimentary close. A. Is located indented 1 tab stop. B. Is located flush with the left margin. C. Is omitted. D. Begin at the center point of the page. Correct answer, B. Is located flush with the left margin. Full block style requires that all paragraphs, dates, addresses, greetings and salutations start on the left margin of the page. 65. When giving a presentation, how long will it take to present a talk, without visual aids, that is 1,000 words long? A. 5 minutes. B. 8 minutes. C. 20 minutes. D. 1/2 hour. Correct answer, B. 8 minutes. A 500-word essay, when read aloud, takes approximately 4 minutes to complete if read at a normal speaking pace. When visual aids are used such as PowerPoint slides or graphics, the pace is slightly slower. 66. Which of the following examples is properly written? A. Fred Felix 2900 Main Street Avenue, Cleveland, Ohio 44115. B. Dr. Sherry Mary, M.D. C. The City of Freedom. D. None of the above are correct. Correct answer, Fred Felix 2900 Main Street Avenue, Cleveland, Ohio 44115. When writing an address, the U.S. Postal Service asks that no punctuation be used to assist the digital readers with accurately barcoding each piece of mail. When addressing a physician, either use the term doctor at the beginning or the credential at the end, but never both at the same time. When noting a city, do not capitalize the word city. 67. When using proofreader symbols, which symbol would you use to correct this sentence? The dog was looking for his bone. A. Circle with a dot in the middle. B. Backslash. C. Front slash. D. An S laying on its side. Correct answer, D. An S laying on its side. The letter S lying on its side designates the term transpose, which means that two letters were placed incorrectly in order in a word or two words were placed incorrectly in a sentence. In the question provided, the letters I and N were transposed in the word looking. 68. When writing a professional letter that has over 200 words, how large should the margins be? A. 1 inch. B. 1 1/2 inches. C. 1 3/4 inches. D. 2 inches. Correct answer, A. 1 inch. Professional letters that have more than 200 words should have 1-inch margins. Letters with a smaller word count would have larger margins depending on the count. 100 to 200 words would have a 1.5 to 2-inch margins, 100 words or less would have 2-inch margins. 69. The number of lines between the inside address and the salutation in a full block style professional letter is A. 1 line. B. 2 lines. C. 4 lines. D. There are no lines between these parts. Correct answer, B. 2 lines. The professional letter using a full block style will have 2 empty lines between the inside address and the salutation. There are 4 lines between the date line and the inside address. 70. When transcribing medical dictation, how would one properly note an allergy to a certain medication? A. Spell out the medication in capital letters or underlined. B. Highlight the allergy in red font. C. Highlight the allergy in boldface font. D. None of the above. Correct answer, spell out the medication in capital letters or underlined. When noting that a patient has an allergy to a medication, the medication should be spelled out in capital letters or underlined when mentioned in the dictation. This will call proper attention to the medication. 71. What keyboard key deletes characters to the left of the cursor? A. Del. B. Control. C. Backspace. D. Escape. Correct answer, C. Backspace. The backspace allows the cursor to be moved to the left and erases the character. Both the DEL or delete key and backspace key are used to delete text. The DEL key deletes text to the right of the cursor, and backspace key deletes text to the left of the cursor. 72. Strep throat. A. Is not contagious. B. Can lead to rheumatic fever. C. Is caused by the bacteria Streptobacillus pyogenes. D. All of the above. Correct answer, B. Can lead to rheumatic fever. A contagious bacterial infection caused by the bacteria Streptococcus pyogenes. Infections of this type can lead to rheumatic fever, an inflammatory condition that could lead to death. 73. Patients with epistaxis. A. Should tilt the head forward, not backward. B. Should be taken to the emergency room regardless of the severity. C. Should be treated with aspirin therapy to reduce the severity. D. All of the above. Correct answer, should tilt the head forward, not backward. Nosebleeds are common occurrences and can vary from being mildly annoying to life-threatening. Moderate to severe bleeding should be evaluated by a healthcare professional. Aspirin therapy could increase the chances for bleeding. 74. A patient with a verruca, choose the best answer. A. Is infected with the HCV virus. B. Can be treated with an OTC medication. C. Is not contagious. D. None of the above. Correct answer, B. Can be treated with an OTC medication. Plantar warts are caused by a strain of the human papilloma virus and can be highly contagious but treated with an over-the-counter medication such as compound W. 75. Aspirin. A. Can be safely given to infants and children. B. Is taken by patients daily in high-dose form to prevent heart attacks. C. Has a side effect of being an anticoagulant. D. All of the above. Correct answer, C. Has a side effect of being an anticoagulant. Aspirin therapy is an often prescribed mechanism for thinning the blood and preventing heart attacks. Daily dose formulations can be purchased over the counter in low-dose capsules or tablets. 76. Cystic fibrosis is an A. Autoimmune disease. B. A condition that can be tested by monitoring the chloride levels of the patient's sweat. C. Disease that can be cured with medications and intensive therapy. D. All of the above. Correct answer, B. A condition that can be tested by monitoring the chloride levels of the patient's sweat. In patients that have cystic fibrosis, chloride levels of the sweat are concentrated at higher levels than the sweat of a healthy individual. CF is a condition that cannot be cured and greatly reduces a patient's predicted lifespan. The condition is genetic and not autoimmune in nature. 77. Patients with HIV. A. Also have AIDS. B. Can spread the disease by casual contact. C. Have engaged in homosexual activity at some point in their lives. D. Can live for many years by taking antiviral medications and practicing a healthy lifestyle. Correct answer, D. Can live for many years by taking antiviral medications and practicing a healthy lifestyle. HIV is the virus that leads to the disease state of AIDS. Patients can live a healthy life for many years if infected with HIV and if they take antiviral medications. Not all HIV patients have engaged in homosexual activity. Many HIV patients have been infected with the virus through drug use, contaminated blood products, or sexual activity with an infected heterosexual partner. 78. Complete the following analogy: the smaller the lumen of a needle. A. The larger the opening of the needle. B. The larger the gauge of the needle. C. The more pain that is produced from the injection. D. The more medication that can be administered at once. Correct answer, B. The larger the gauge of the needle. Needle gauge is determined by the size of the lumen. The larger the size of the lumen, the smaller the gauge size. A 16-gauge needle has a larger lumen than a 21-gauge needle. 79. A doctor's order is written to give a patient a medication using a nonparenteral route. Which of the following is a nonparenteral route of medication administration? A. Rectal suppository. B. Intracardiac. C. Foredrip. D. IM injection. Correct answer, A. Rectal suppository. Parenteral medications are given through routes other than the GI tract. Nonparenteral medications are injected or given through the skin or mucous membranes. 80. A patient is morbidly obese. Which of the following needles would be best to give an IM injection in the deltoid? A. 25 gauge 5/8 inch. B. 27 gauge 1/2 inch. C. 21 gauge needle 1.5 inches. D. 16 gauge needle 3 inch. Correct answer, C. 21 gauge needle 1.5 inches. Medications that are to be administered by the intramuscular method are intended to be delivered to muscle tissue. Patients whom are obese will have a larger area of subcutaneous tissue covering the muscles. Using a longer needle will ensure the medication is delivered in the proper area. However, a needle that is too long could damage bones, nerves, and other anatomical structures. 81. When giving an injection of insulin, which of the following is true? A. The deltoid muscle is the preferred injection site for insulin. B. The angle of the needle should be 90 degrees. C. The site should not be massaged after medication administration. D. All of the above are true. Correct answer: C. The site should not be massaged after medication administration. Insulin injections are given subcutaneously. The site should not be massaged after administration as the medication needs to distribute slowly. 82. When giving a patient eye drops. A. The proper medical term for this procedure is instillation. B. Pull the lower eyelid down and place the drops in the conjunctival space. C. Allow the patient to blink a few times after administration to help distribute the medication. D. All of the above. Correct answer: D. All of the above. Proper instillation of eye medication is to place the drops in the conjunctival space and allow the patient to blink after instillation to distribute the medication. 83. Buccal administration of medications. A. Should be done under the tongue. B. Are done to allow controlled dosing through the mucosa. C. Are best to use in small children. D. All of the above. Correct answer: B. Are done to allow controlled dosing through the mucosa. Buccal administration methods are used to control the flow of medication through the mucosa of the cheek and the inner mouth. Monitoring this process in small children is difficult as infants and toddlers may swallow the medication. 84. ID injections are used for which of the following procedures? A. Allergy testing. B. TB testing. C. Drug sensitivity testing. D. All of the above. Correct answer: D. All of the above. The intradermal route of medication administration is used to test for allergies, test for exposure to tuberculosis bacteria, and to monitor sensitivity to reaction-inducing medications. 85. A medical assistant is applying a transdermal patch. Which of the following procedures should the MA use and why? Choose the best answer. A. The MA should use gloves to protect herself from getting the medication on her hands when applying the patch. B. The MA should tell the patient to change the patch as many times as necessary if it appears to be falling off. C. The MA should place the patch in an area that the patient cannot reach to avoid the temptation for the patient to pick at the patch and have it fall off. D. The MA should instruct the patient to contact the office each time the patch is changed. Correct answer: the MA should use gloves to protect herself from getting the medication on her hands when applying the patch. Transdermal patches contain medication that is intended to slowly be absorbed through the patient's skin. Medical assistants should wear gloves or wash hands thoroughly after applying the patch to avoid absorbing some of the medication. 86. A doctor orders 50 mg of medication. The available dose is 5 mg per 2 ml. How much medication should be given to the patient? A. 20 mg. B. 5 ml. C. 20 ml. D. 10 ml. Correct answer: C. 20 ml. The patient should be given 20 ml of the medication as each milliliter contains 2.5 mg of medication. 87. Clark's rule. A. Is based on BSA. B. Uses the child's weight and height. C. Uses a nomogram. D. Uses a child's weight and assumes the child's weight and height are in proportion. Correct answer: D. Uses a child's weight and assumes the child's weight and height are in proportion. Clark's rule is a method of calculating children's dosages based on a child's weight. This rule assumes that the child's weight and height are in proportion and uses the weight of 150 pounds as the adult average weight. 88. Nonverbal communication is A. Not the most utilized form of communication. B. Uses facial expression and body language to send messages. C. Most often used when sending messages over email or telephone. D. An ineffective manner of communication. Correct answer. B. Uses facial expression and body language to send messages. Nonverbal communication involves communication that is given by body language. Most messages are sent between sender and receiver using nonverbal communication. 89. Which of the following scenarios provides an example of a medical assistant overcoming a barrier to communication? A. A medical assistant uses a lecture as a means of explaining how to run a finger-stick glucose test to an elderly patient. B. A medical assistant writes her directions to a patient that is hearing impaired. C. A medical assistant speaks loudly to a patient who speaks a non-English language. D. A medical assistant uses the terms micturate and defecation while talking with a minor. Correct answer. B. A medical assistant writes her directions to a patient that is hearing impaired. Overcoming barriers of communication involve using methods of communication that are understandable to the receiver. In the example provided, a deaf or hearing impaired patient would have an easier time understanding directions if they are written to overcome the obstacle of hearing loss. 90. A patient who is displaying the defense mechanism of compensation would A. Refuse to hear unwanted information. B. Transfer feelings of negativity to someone else. C. Overemphasize behaviors which accommodate for perceived weaknesses. D. Place blame on others for personal actions or mistakes. Correct answer. C. Overemphasize behaviors which accommodate for perceived weaknesses. Compensation means to overcome a perceived weakness by overcompensating another behavior or personality trait. 91. Assuming that an elderly patient will have a difficult time understanding the directions for how to take medication is an example of A. Prejudice. B. Stereotyping. C. Encoding. D. Rationalization. Correct answer. B. Stereotyping. Stereotyping is defined as providing a generalization about a person based on his culture. The medical assistant in this situation was stereotyping her patient by believing that her patient would automatically have a difficult time understanding directions based solely on the fact that the patient is elderly. A prejudice is forming a negative opinion of someone based on his or her heritage or culture. 92. Which of the following questions is considered open-ended? A. What time did you last take your medications? B. Are you feeling okay right now? C. Please describe your symptoms. D. What day are you available for a follow-up appointment? Correct answer. C. Please describe your symptoms. Open-ended questions are questions that will yield an answer that is detailed and descriptive. Closed-ended questions will yield answers that are 1 or 2 words in length. 93. What are the 3 necessary components of communication? A. Sender, receiver, feedback. B. Sender, message, receiver. C. Message, feedback, clarification. D. Sender, interpretation, receiver. Correct answer. B. Sender, message, receiver. The 3 necessary components of communication include sender, message, and receiver. If any of these components are missing, communication cannot occur. 94. Which of the following would be an inappropriate and potentially unlawful interview question? A. Where do you see yourself in 5 years? B. Do you have any commitments outside of work that would hinder your ability to be a high performer? C. How do your children feel about your decision to work here? D. If you could pick any color, which would it be? Correct answer. C. How do your children feel about your decision to work here? Interview questions which focus on a person's religious affiliation, marital status, or number of children are unlawful and cannot be legally asked during an interview. 95. A patient that is using a psychological behavior to deal with negative emotions is said to be employing a defense mechanism. B. Therapeutic use of self. C. Behavioral modification. D. Essential use of rationalization. Correct answer. A. defense mechanism. Defense mechanisms are a process of dealing with unpleasant emotions. Patients using this type of behavior may be experiencing feelings that are unwelcome. Reacting in a way that helps them deal with their emotions without addressing these feelings is a protective mechanism. 96. The best way to avoid injuries when using computers is: A. Stand and stretch every hour. B. Adjust the seat height so that your feet are flat on the floor. C. Adjust the monitor so that your neck is at a neutral angle. D. All of the above. Correct answer: D. All of the above. Using ergonomic practices will reduce repetitive strain that is common in office employees. Frequently stretching, adjusting chairs and monitors to avoid strain, and paying attention to avoid aches and pains will reduce injuries. 97. The most effective way to prepare a schedule matrix is to: A. Schedule patients as walk-ins from 9 to 5, notifying the doctor when to be present in the office. B. Create a matrix for each appointment type, e.e. one for GA visits, one for OB visits, etc. C. Have the doctors provide you with their schedules and block out times they are unavailable. D. Schedule matrices are antiquated and are no longer used with electronic systems. Correct answer: C. Have the doctors provide you with their schedules and block out times they are unavailable. The first step in forming a schedule matrix is to gather the work schedules of all of the doctors in the practice. For times that the physicians are unavailable, block out those times so that patients cannot be scheduled. 98. What is the benefit of the advanced scheduling system? A. Walk-ins are accommodated easily throughout the day. B. Emergencies can be handled more effectively and with more staff. C. Allows patients to plan ahead with their healthcare needs. D. Patients have an easier time remembering appointments. Correct answer: C. Allows patients to plan ahead with their healthcare needs. Advanced scheduling systems involve pre-scheduling. This allows patients to prepare for their exam ahead of time. 99. The advantage of a handwritten appointment book is: A. Computer-deficient employees can easily use the book. B. Books are accessible even when the computer server is down. C. Handwritten books are cost-effective when compared to computerized systems. D. All of the above. Correct answer: computer-deficient employees can easily use the book. Employees who are not proficient at using computers may feel more comfortable using a manual scheduling system such as a schedule book. However, these methods are antiquated and are being replaced with computer-operated systems. 100. Which of the following scheduling methods would be best for an urgent care setting? A. Wave scheduling. B. Double booking. C. Open hour scheduling. D. Modified wave scheduling. Correct answer: C. Open hour scheduling. Open hour scheduling is also known as walk-in scheduling and best suits emergency clinics. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.